Hello, I'm Joan Retman, Area Community Relations Director at the Gardens at Town Square, which is one of 8 premier retirement communities owned and operated by Era Living. Before we start today's presentation on music therapy for dementia, I would like to share a little bit about Era Living Memory Care. This program is offered in a secure, home-like environment at 2 of our Era Living communities, Ida Culver House Broadview, which is in Northwest Seattle, and the Gardens at Town Square, located in downtown Bellevue. On your screen, you'll actually notice a slide which reads the terrace at the Gardens at Town Square, and that shows an example of a model apartment that is here at our Bellevue location, the Gardens at Town Square. Both of these communities also offer independent living and assisted living on the same campuses. As part of the team here at the Gardens at Town Square, I am proud to share that the memory care program here has been a reliable, steadfast resource in Bellevue for almost 20 years now. And we know that although our environment is quite lovely with private apartments and an inviting courtyard filled with flowers and greenery, what makes it truly special are the staff and the way that they interact with our residents in such a personalized way. Should you choose to visit us, I would be more than happy to introduce you to several of these very special team members who have been part of all various departments, like our activities programs, dining, and care teams for over 10 years each. And now I'd like to introduce our speaker for today's event. We are so honored to host Dr. Kim, who will be presenting today on music therapy for dementia. Dr. Kim is a postdoctoral researcher at the University of Washington School of Nursing. She received a PhD in nursing at the University of Pittsburgh School of Nursing in 2019. She also conducted postdoctoral research at Pennsylvania State University College of Nursing prior to joining the University of Washington. And welcome, Dr. Kim. It's so great to have you here today.
Yeah, good afternoon. So thank you for the introduction. So I'm going to take a moment to share my slides. Okay, can you see my screen? Okay, let's get started. So thank you for the introduction and good afternoon, everyone. My name is Hyejin Kim. And as Joanne mentioned, I completed my PhD in nursing at the University of Pittsburgh in 2019. And I'm currently a postdoc researcher at the University of Washington School of Nursing. So I was a STEM nurse in South Korea for about 4 years. And at the time, I realized that what I really wanted to do is improve the quality of life for older adults, like especially cognitive health through research work. So during my 10 years of pre and postdoc training, my research has centered on late life cognitive impairment, such as mild cognitive impairment and Alzheimer's disease and dementia. So today, I will be presenting our current research team's project, the music therapy for people with dementia and their family caregivers. And I'm really happy to share our current work with you today. Yeah, so thank you for inviting me. So first, I will talk about brain changes with aging, excuse me. And then I will talk about the definition of dementia and its symptoms, causes like treatment and diagnosis. And then I will show you how music connects people with dementia to the meaningful moment of life. And then I will share our team's current music therapy for people with dementia and their family caregivers who are living at home. And then I will finish up this presentation with our future plan for music therapy. So It is true that a child brain is more plastic and more capable of new learning than a typical adult's brain, as you can see in the picture. So unfortunately, we do lose neurons, which are nerve cells, as we age. So the brain shrinks with increasing age. And even if you are healthy, changes in memory and thinking may include like more challenges with multitasking and increased, difficulty in finding appropriate words and a minor decrease in the ability to pay attention. So what is dementia? I think as many of you may know, dementia indicates the loss of cognitive, like reasoning and thinking abilities over time. And it is not a single disease like, heart disease. So heart disease includes coronary artery disease, arrhythmia, and heart attack. So dementia is like heart disease. So it's an overall term for a lot of types of dementia. However, you may know Alzheimer's disease is the most common type of dementia. There are many other types of dementia, such as Lewy body dementia, vascular dementia, frontotemporal dementia, and mixed dementia. And you may hear people ask, like, what's the difference between Alzheimer's disease and dementia? So to be clear, as I mentioned, Alzheimer's disease is dementia, but Alzheimer's disease is the most common type of dementia. So that's the reason Alzheimer's disease gets more attention than another type of dementia. Also, a person who has Alzheimer's disease could have another type of dementia as well. So I know dementia is very confusing, but all types of dementia causes cognitive changes, and symptoms of dementia can vary. However, like common types of, common symptoms of dementia like includes problems with remembering things, like remembering appointments, and problems with short-term memory rather than long-term memory, and problems with like paying bills. And a lot of experts, they believe that dementia is caused by damage to brain cells. However, unfortunately, we don't know much about like what specific behaviors or factors are really related to dementia. And there's no one test to determine if someone has dementia. So doctors, they diagnose Alzheimer's disease and other types of dementia based on a thorough medical history and, a physical examination and lab test. And they look at individuals' day-to-day function, like changes in day-to-day function and behaviors. And speaking to the treatment, unfortunately, there's no cure or treatment for dementia. But a couple of oral medications were approved by the US Food and Drug Administration. However, those drugs are for the symptoms of dementia, and those drugs are to delay the worsening, the cognitive changes. So, which means that those drugs are not a cure or treatment for the disease. So in summary, Alzheimer's disease, which is the most common type of dementia that was first reported in 1906 by Dr. Alzheimer in Germany, and it's been almost 120 years since then. However, it is still a very confusing age-related disease. So before I talk to our music therapy, I would like to share this 2-minute video music moment from the Alzheimer's Association. So this video shares a song's ability to connect us to the most meaningful moment of life. So I'm gonna stop sharing this slides and then share the video. So can you see my screen? Let's get started. If you have any problems, just let me know.
I was actually just getting my record deal when I found out my grandmother was starting to get worse with Alzheimer's. I still see her face in the crowd now, even though she's not here anymore.
My mom has Alzheimer's. She's had it for 13 years.
My connection to Alzheimer's is my grandfather.
My grandmother is going through this as well right now.
Song is what can really be a remedy for the hard times that surround Alzheimer's.
I picked the song, If My Love Could Kill.
Dock of the Bay.
Hello in there. Backwards breathing.
Dream in My Dreams.
Annie.
Stand By Me.
Raymond was a song I wrote about my grandmother.
I wrote Hard to Grow Up, and it was pretty close to after the time I lost my mother.
I was just writing these songs for me, and when they have a resonance with people's lives, then that's an unexpected bonus.
When people hear this song, I just hope that they don't feel alone.
When you're going through things, when you're not at your strongest point, you want somebody to be there for you.
A lot of times things seem insurmountable. Then you hear a great song, and all of a sudden you feel like, okay, this is doable. This is something that we can handle. Music has the power to make people feel that way.
Music's powerful like that.
It lights something, it ignites something. It's some kind of magic. It's the magic of music.
Hey, dude, don't make it bad. Take a sad song and make it better.
It's a possibility, a potential in all of our lives. Whatever research we can do at this present time is absolutely important.
If they could find a cure, it would be heaven.
I think awareness is the key to everything.
And if music can help with that in any way, that's a very special thing for an artist.
We're gonna find a day when Alzheimer's is no more, and we will sing a lot more songs about it.
I can't whistle this time of the morning.
So let's get back to the slides. So how was that? Yeah, as one of the musicians mentioned in the video, if music can help people with dementia or their family caregivers, it is also a very special thing for a researcher like me. And let's look at this picture of the effects of music on the brain. So as you can see, like area in the brain is, are engaged in the task when the brain is listening to music, which means that, the areas of the brain are being activated when a person is listening to music. And I would like to share one more video, this example, a former ballerina living with Alzheimer's disease. She's transformed as she listened Tchaikovsky's Swan Lake. So I'm gonna stop sharing the slides again and then share the video again. Okay, let's get back to the slides. So how was that? Isn't it amazing? I think it is the magic of music, right?
Yes, and more.
Thank you.
I'll explain later my reaction to that.
Okay. So I think music is a powerful tool for people with dementia and their family caregivers, because music may help people with dementia and their family caregivers to reduce their stress. And music also, may help to improve communication between people with dementia and their family caregivers. And it may help people with dementia to reduce their abnormal behaviors like agitation. And music may also help people with dementia to improve their memory and thinking abilities. So before moving on to our music therapy intervention study, I just wanted to make sure that you correctly understand music and dementia. So this is a very simple yes or no question. So you can answer using the chat box, chat box features, so you can answer the question. So first question is, dementia is a normal aging process. What do you think? Yeah, that's correct. This is incorrect. So dementia is an abnormal aging process because, as I mentioned, dementia is caused by damage to brain cells. And the second question is Alzheimer's disease is dementia. What do you think? Yes, this is correct. As I mentioned, Alzheimer's disease is the most common type of dementia. So Alzheimer's disease is also dementia. And the next question is, persons with dementia first experience long-term memory changes rather than short-term memory. Oh, are you ready? Yeah, click the button. So yeah, I'm not sure whether I mentioned this, but persons with dementia, they first experience short-term memory changes rather than long-term memory changes. So they could remember what happened like 30 years ago, like 10 years ago, but typically they cannot remember what happened like yesterday. But people with dementia, in the late stage of people with dementia, they could not remember like 10 years ago and, happened what, yesterday. So yeah, so this is the incorrect statement. And the last one is, do you think music has a positive effect on the brain?
No. Oh, yes. Yes.
Yeah, there's no question. So music has a positive effect on the brain. So let's move on to the next slide. Okay, so our research team, we developed an in-home online music intervention for people with dementia and their family caregivers, because we wanted to see whether our intervention reduces stress among individuals with dementia and their family caregivers. And why we developed an in-home online music therapy? The reason is that the first one is research shows that the majority of individuals with dementia are living in the community, especially at their home, rather than a long-term care facility. And research shows that persons with dementia living at home, they felt their lives to be more meaningful and autonomous than people with dementia who are living in long-term care facilities. And last one is that, online music intervention is easy to use and they can access to the program anytime they want to. So in our study, we recruited older adults with dementia and their family caregivers who are living at home. And we recruited participants at the Memory Evaluation Center in Sweden. So this study was conducted in Sweden, not the United States. And we collected individuals' saliva to measure the levels of stress, because saliva provides more accurate result for stress. So our study coordinator, she provided an education session about our music intervention and how to collect saliva to persons with dementia and their family caregivers. And this education session was provided either a group-based or one-on-one session. And as I mentioned, this is an online music intervention, and this program was developed by a lot of experts in the area of dementia care. So participants, they could attend this program at their homes whenever they want to. And participants, they could choose the song based on their preference. So if you want to listen to classic, they could choose classic music. And if you want to listen to like pop song, there's a list of pop songs. So they could choose the songs, whatever they want, and then they can listen to music or sing a song. So in our study, we compared two groups. So the first group, they received our 8 weeks of music intervention. And the second group, they did not receive our music intervention. So in the intervention group, we included 24 individuals with dementia and their family caregivers. And in the comparison group, we also included 24 individuals with dementia and their family caregivers. However, they did not receive our music intervention. And after the 8 weeks of music intervention, we examine changes in levels of stress. And as I mentioned before, we collected individuals' saliva. So we provided them saliva tubes with barcoded labels. We also provided the saliva collection handbook. And we provided hands-on training to the participants. And the participants, they collected their saliva 3 times a day, 2 for morning, 1 for evening, for 5 days, from Sunday to Friday, for 8 consecutive weeks. So after the 8 weeks of music intervention, can you imagine what happened? Do you think that our participants' level of stress were, increased or remained the same? Or do you think that the participants' levels of stress were improved? I mean, their stress levels are decreased. Interestingly, like a quarter of our participants, they reported that they experienced stress reduction throughout 8 weeks of our music intervention. And as I mentioned, we also collected, individuals' saliva to see their levels of stress. So let's take a look at our participants' levels of stress. So here's our, one of our participants' levels of stress. So as you can see, like patient A's morning and evening cortisol was reduced over the 8 weeks of music intervention, which means that patient A's levels of stress, were decreased through the music intervention. And we also looked at the patient A's caregiver, caregiver A's levels of stress. So speaking to morning saliva cortisol, the picture is a little bit busy, but overall, caregiver A's levels of stress were also decreased over the 8 weeks of, music intervention. And in addition to saliva collection, we also tested caregivers' perceived stress and coping skills before and after our music intervention by asking them using stress questionnaires. So here's the result. As you can see, in the intervention group, like half of caregivers who received our music intervention, they reported that they felt less stress after the music intervention. And on the other hand, less than 10% of caregivers who did not receive our music intervention, they reported that they felt less stress after 8 weeks. And speaking to coping skills, as you can see, like 1/3 of participants who received our music intervention, they told us that they had better coping skills after the 8 weeks of music intervention. However, as you can see, like less than 10% of caregivers who did not receive our music intervention, they reported that they had better coping skills after 8 weeks. So what's the key messages from our music intervention study? I think our study suggests that like listening to music or singing a song may have emotional benefits. In particular, music can help people with dementia and their family caregivers who are living at home to reduce their stress. So, Stevie Wonder, who is my, one of my favorite American singer-songwriter, he says that music is a word within itself, with the language we all understand. I think this is totally true, right? And another singer-songwriter, Billy Joel, he says that music in itself is healing. It's an explosive expression of humanity. It's something we are all touched by, no matter what culture we are from. Everyone loves music. So what do you think? I totally agree with him. So what's the next step of our research? So our next plan is to develop a music intervention in virtual reality. So people with dementia or their family caregivers, they could sing a song or play a musical instrument in virtual reality, because we think that this is more active participation than the music intervention we provided. So we hope that this program, this intervention improves the quality of life for people with dementia and their family caregivers. So thank you for your time. I'll stop sharing and I'm happy to take any questions.
Well, I have some thoughts on this whole agenda or process. I started playing my journey with playing the French horn at age 13, and in another couple of months, I'll be 83. And my father died from dementia. My younger brother is at least 2 steps beyond where I am in dementia. I might be in stage 2 because stage 1 is no effect in a 7-stage categorization of levels of dementia by the Alzheimer's Association. And anyhow, playing an instrument mobilizes not only what you get from what you hear music, but it activates many other portions of the brain. And more important, one of the important ones I would think would be muscle memory. Because when I look at a music on the page, I know where to put the stress of my muscles in my face, and I know where to put my fingerings on my hand and where to put my hand on the bell. It's everything in my body that's being driven by that music. in terms of the brain function. And I was so glad to see that you were beginning to address that as the final portion of your presentation. And it's important to me to know what my options will be to continue to do, to enable those activities as my journey may advance. And I personally can take my computer here and download a video of an orchestra and get up the sheet music for my part on the screen and play along with it. But the virtual reality would be a step beyond that, I would think. But how you implement that to the various programs of the memory care unit world is not clear to me at this time.
Yes, and thank you for sharing your experience. So could you say that again? So you are wondering about our future plan, like?
Yeah, well, how to provide guidance to facilities such as the one that's sponsoring this video, which I've been to several times because my wife's dad lives there for a while. And we're in the process of perhaps moving to an assisted living facility, of giving them guidance as to how to develop programs that take advantage of the things that you are learning.
Yeah, that's a really, really good question. So we have to have a pilot study because it's a very baby step, something like that. So I think we need to thought about, that we need more opinions and like thoughts about our program. So we need to have a focus group interview, like pilot study, how it works. But it's a kind of overall concept because in virtual reality, like people could like play a musical instrument and sing a song. It's a kind of a, as I mentioned, more active participation, but we need, as you mentioned, more clear plan how to implement among persons with dementia and their caregivers, because I heard that for people with dementia it might be challenging to wear a goggle. So yeah, we need more research how to implement our study.
Well, I have seen perhaps examples of them having choral groups within the facility, and maybe that more simpler instruments than my horn, they could provide guitar lessons or something that would be more adaptable to that environment. So, like I said, the passive listening is a step, but you saw that dancer. She was mobilizing the muscle memory that she had from her dance.
Yeah, absolutely. Yeah.
And I think that that's a much stronger activation, actifying of what's going on in the brain.
Absolutely. Thank you for your suggestion.
Okay.
Thank you.
Dr. Kim, I wanted to jump in with to see if you have any commentary or any thoughts to share about the 60 Minutes program that came out recently with Tony Bennett and Lady Gaga. By chance, have you seen that production? And if so, do you have any comments on that?
I'm very anxious to find it on the internet because I missed it when it was a broadcast, because I'm a huge fan of that pairing between the two of them. It's just really special.
It was wonderful. Dr. Kim, did you have a chance to see that program?
Unfortunately, no. I'm gonna, yeah.
Okay. For those who are maybe not as familiar, if you have a chance, you can do a search to just search on YouTube for 60 Minutes and type in Tony Bennett and Lady Gaga. If you're not familiar, Tony Bennett has progressed into later stages of memory loss, appears maybe likely to be Alzheimer's. And Lady Gaga, of course, a musician who's much younger, if you're not familiar, who is very popular these days, paired up with him to do a performance. And it's amazing. It's amazing because I'm sure everyone has seen him perform at some point in his life. He has a difficulty having just normal conversations at this point. But when he was asked to go on stage, he did a performance with her. It was like flipping a switch, and he was back to his normal self. He was working the room. He was entertaining everyone just like he normally would. He just flipped back into who he's always been, which is a performer, and singing every word of every song just beautifully. So if that also doesn't share a message of how important music is and how impactful it is, I don't know what does. It was very moving, very emotional to watch that. I highly recommend it.
Thank you.
Is there anybody else that has any questions or would like to type anything in chat? Okay, well, of course, if you have other questions, a lot of times these questions do come up after the fact, and we're always happy to receive that information from you, forward your questions to Dr. Kim, and then get back to you with that information. So, so Dr. Kim, I just wanted to thank you so much for sharing your insight in this very important subject matter, and I'm really excited to see what comes from your research, what happens next as Dick was asking those questions. I think we're also curious and how we can implement those types of things into the musical programs that we already have in place. There's so much room to grow and improve from here, and we're so excited to hear what comes next. So thanks so much. And what will happen next for everyone who's joining us is we will be sending out an email to all of the attendees today to ask for a little bit of feedback from you. So there will be a link that you'll click on. It's a very short survey. Please take the time to do that for us. We appreciate that very much. And if you would like a copy of the recording of this video, let us know as well. We'd be happy to send that out. And we look forward to seeing you all again. Thank you, Dr. Kim.
Thank you for inviting me. Happy holidays.
Happy holidays, everyone. Bye-bye.